Good evening, everybody. I'm Dr. Michael Lutz, and I'm the president of the MIU Men's Health Foundation. And tonight you're joining us for our prostate cancer survivorship series, which we hold quarterly throughout the year. Tonight is a very special event, and we're very proud to have our sponsors, Blue Earth, Karmanos, and the American Cancer Society as our proud sponsors and partners to help make this event a possibility for all of you. For 13 years, we've been holding our prostate cancer survivorship series, and we've always focused on the patient as the survivor. Tonight is different. Tonight, we're going to talk about the caregiver. The silent person in the background who will now come into the foreground is the person that is actually your heartbeat, the person that actually helps you get through the crisis, and the person that really will mean everything to you. The caregiver can mean a lot of things. It can be your spouse. It can be your other partners. It can be your children. It can be a cousin. It can be just a dear friend. But whoever your caregiver is, they play a very important role in your survivorship. And tonight we're going to actually talk about the role of the caregiver. So a couple notes about caregivers in just a moment. But first, I'd like to actually introduce our partners with us tonight. So tonight we have two guest panelists. We have Kathleen Hardy. She's a licensed master of oncology social worker at Karmanos, and she's devoted her career with thriving with cancer, assisting patients, families, and especially caregivers. We've worked with Kathleen on a number of other survivorship events, and she always brings a lot of great food for thought for the table tonight. And I'm really proud to have her with us. And thank you, Kathleen.
Thank you.
Thank you. And as well, we have Julie Booksh. I've known Julie now for a couple of years. She actually worked with us at one of our men's health events in downtown Detroit, talking about mental health for our men's health community. She's a counselor and teacher who specializes in the integration of spirituality and psychotherapy. She received a master's degree from the University of Holy Cross in New Orleans and will bring some of that Southern spice to this conversation. And I know that will happen. You know, caregivers are really interesting. Many caregivers actually have shown that they lose 4 to 8 years of their lifespan just by being a caregiver. And that right now in the United States, 1 out of every 5 people in the United States is a caregiver. The Rosalind Carter Institute for Caregiving says that there's going to be 4 people in this world: those who've been caregivers, those who are currently caregivers, those who will become caregivers, and those who will need caregivers. And so oftentimes we want to discuss some things about some personal strategies as a guide through these challenging times for caregivers, but I'm going to actually defer to our panel and let them actually share their thoughts. So I think the first thing I'd like to touch on tonight, and I'd like to have Kathleen address this first, is when men are first diagnosed with prostate cancer, how do they actually deal with it psychologically? And what are some of the tips that you sometimes will kind of bring in, some of your things that you use to help men actually cope with the diagnosis so they can move from the diagnosis onto treatment and beyond?
So I think everybody's a little bit different, but most often men diagnosed with cancer, prostate cancer, are in a state of shock often. They go through a grieving period of grieving the loss of their health as they knew it. They feel kind of out of control because nobody plans on having cancer, and overwhelmed in a lot of uncertainty and unknown. And that's hard for most people to live with. So I encourage men recently diagnosed to talk about that, to recognize how normal that is. And also that as they come up with a plan and start the treatment process, and realize, like I hear the men in my men's group say, that once they get on treatment and they realize, I can manage this, I can handle it, then some of that anxiety and stress kind of reduces a little bit. And then they can often see the light at the end of the tunnel.
Yeah,